Today we will be talking about diabetes. Did you know that diabetes is the cause of about 5% of all deaths globally each year? That is more than 345 million people. According to the American Diabetes Association in January 2011, 25.8 million people in the U.S. have diabetes. 7 million of those are undiagnosed. Additionally, 79 million people are currently considered to have prediabetes based on their fasting glucose and A1C levels, which we'll talk more about later. Adults are not the only ones affected by diabetes. Reports of type 2 diabetes in children have increased worldwide. Roughly 1 in 400 kids have diabetes. There are 3 types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes occurs when a person's immune system attacks the insulin-producing beta cells in the pancreas. Therefore, people with type 1 diabetes are no longer able to make insulin. We will talk more about what insulin is later. People who have type 2 diabetes still make insulin, but their bodies either do not produce enough insulin or the cells ignore the insulin. In this case, the insulin is there, but it does not work. Women with gestational diabetes have diabetes that develops during their pregnancy. It does not mean that they have diabetes before conceiving or that they will have diabetes after giving birth, but it is important to control their glucose levels while they are pregnant. Now we will delve deeper into each of the types of diabetes. Type 1 diabetes. Out of all the people with diabetes, 5 to 10% of people have type 1 diabetes. Type 1 diabetes is usually due to their DNA. These patients are usually younger, and these patients completely rely on insulin. Type 2 diabetes. Type 2 diabetes can also be associated with your genes. No, not those genes. If your family members have diabetes, you are more at risk for developing type 2 diabetes. This type of diabetes is the most common out of all of them. Out of all the people with diabetes, 90 to 95% have type 2 diabetes. People with type 2 diabetes are usually older and have an apple body shape, meaning they carry most of their weight around their stomach. Type 2 diabetes is developed over time and can be preventable. Later, we will discuss more about type 2 diabetes and how you can prevent it. Gestational diabetes. Gestational diabetes happens in women who are pregnant. About 3 to 8% of pregnant women are diagnosed with this kind of diabetes. These effects are similar to type 2 diabetes. Women with gestational diabetes usually have bigger babies that are around 9 pounds. Most women will not be diabetic after their baby is delivered, but 40 to 60% of mothers who had gestational diabetes will have a chance to become a type 2 diabetic patient. Now let's take a look at a day in the life of Cici. Cici has been feeling very tired lately. She decides to make an appointment to see her doctor.
Hi, I would like to make an appointment to see Dr. Sugars today on my lunch break.
Hello, Cici. What can I do for you today?
Well, I've been noticing that I've been eating more, and I'm always thirsty, but I have lost 5 pounds. I've also noticed that I've been falling asleep at work, and I'm always tired.
Well, Cici, it sounds like you're exhibiting some common symptoms of diabetes, such as increased hunger and thirst, fatigue, and unusual weight loss. Some other common symptoms of diabetes include frequent urination, frequent infections, blurred vision, tingling numbness in the hands and feet. Let me run a couple tests so we can figure out what's going on.
Diagnostic tests. There are 3 main lab tests a doctor can order to determine whether or not you have diabetes. One diagnostic test is a fasting blood glucose test. This will measure the glucose or blood sugar levels after 8 hours of fasting. A glucose level of greater than or equal to 126 milligrams per deciliter is indicative of diabetes. Another diagnostic test is the hemoglobin A1C test. This measures the percentage of total hemoglobin in the body that is bound to glucose. A value of greater than or equal to 6.5% is indicative of diabetes. The third way a doctor can diagnose diabetes is by doing a 2-hour plasma glucose test. This is when a patient is given an oral dose of glucose, and the levels of glucose in the blood are monitored throughout a 2-hour time period. After 2 hours, a plasma concentration of greater than or equal to 200 milligrams per deciliter is indicative of diabetes.
Well, Cici, after running some tests, here are your results. Your fasting glucose level is 225 milligrams per deciliter. Your 2-hour plasma glucose level is 280 milligrams per deciliter, and your hemoglobin A1C is 7.2%. The lab work confirms you have type 2 diabetes.
Oh no, is that serious?
Don't worry. Diabetes is very common, and many people can live a normal life by controlling their blood glucose level. Let me tell you what's going on in your body.
The disease. We can look at diabetes using a lock and key model. Think of the key as insulin, and the lock as the receptors on the cell membrane. Normally, after we consume a meal, the glucose level in the blood rises. At this time, the pancreas will secrete a hormone called insulin. Remember, insulin is like a key that binds to the receptors on our cell membrane, which can be thought of like a door. Once the insulin binds, it opens the door for the glucose to enter the cell. Now the glucose is in the cell and can be used by the body. However, in type 1 diabetes patients, the pancreas can't produce insulin, which means there is no key to open the door. In type 2 diabetes, the pancreas may produce some insulin but not enough to carry out its function, or the pancreas can produce a normal level of insulin, but the cell does not recognize when the insulin binds and therefore the door does not open. As a result, the glucose level in the blood rises up, leading to many complications in other parts of the body, such as the heart, eyes, legs, and kidney. Risk factors. Many people can be a risk for diabetes for a variety of reasons. The risk factors for developing type 2 diabetes are impaired glucose tolerance or impaired fasting glucose, persons over the age of 45, people who are overweight or obese, sedentary lifestyle, people with a family history of diabetes, low HDL, high triglyceride, and high blood pressure, certain racial and ethnic backgrounds such as African Americans, Mexican Americans, American Indians, Native Hawaiians, Pacific Islanders, and Asian Americans, and women with gestational diabetes.
So how can I treat my diabetes?
Lifestyle modifications.
Well, there's 2 main changes that you can make in your everyday life that can help with your diabetes.
The first thing you can do is watch what you eat. Eat more fruits, vegetables, and whole grains. The second thing you can do is work out those muscles. You can start slow by just taking a walk around your neighborhood and increasing the intensity of the exercise gradually. But make sure you have a small snack before exercising so your blood glucose doesn't drop too low. Losing 10 pounds can make a huge difference in controlling your diabetes. Medications. There are a number of medications available to treat type 2 diabetes. The most common one is metformin. Metformin can help to decrease your blood glucose levels by preventing your liver from producing more glucose. It also helps decrease your blood glucose by enhancing the effects of insulin. Remember, insulin is the key that opens the door and lets glucose into your cells and out of your blood. Another alternative treatment is injectable insulin. This can be used in combination with an oral drug like metformin. Remember, as we discussed earlier, patients with type 1 and type 2 diabetes either don't produce insulin or their insulin doesn't work well. Thus, we can help the body out by giving it insulin in the form of an injection. ABCs for people with diabetes. It is important to remember a few simple things when you have diabetes. We like to call these the ABCs. A stands for reaching the A1C goal we talked about before, of less than 7%. B stands for blood pressure. The ADA recommends that your blood pressure be less than 140/80 millimeters of mercury. It's important to keep your blood pressure controlled to prevent further complications. C stands for cholesterol. There are 2 types of cholesterol that are important to know. The LDL cholesterol is what most people call the bad cholesterol in your body. Too much LDL can build up and clog your blood vessels, so you want this level to be lower than 100. Also, you have good cholesterol, called HDL cholesterol, and you want to keep your HDL level higher than 40 for men and 50 for women. By making lifestyle changes and using your medications correctly, you will be able to reach these ABC goals, control your diabetes, and prevent other complications that can harm your body. Complications. Being unaware of diabetes or letting the disease go untreated can lead to serious complications. A short-term complication is that patients may experience hypoglycemia. Hypoglycemia means your blood sugar level is too low, and the patient may feel shaky, sweaty, anxious, dizzy, hungry, weak or fatigued, irritable, have a fast heartbeat, blurry vision, or headache. Another short-term complication is that patients may experience hyperglycemia. This is the opposite of hypoglycemia and is the result of blood glucose levels being too high. Patients have experienced frequent urination, dry skin, hunger, extreme thirst, blurred vision, drowsiness, and infections or injuries that heal more slowly than usual. Long-term complications from uncontrolled diabetes have affected many areas of the body. The heart. Diabetes patients have high potential to develop heart disease and are at risk for high blood pressure, stroke, and heart attack. The kidneys. Diabetes also puts a person at risk for kidney disease. Kidneys filter glucose, but too high levels of glucose in diabetes patients can cause kidney damage, resulting in your kidneys failing to function normally. Hands and feet. High blood glucose can damage the nerves and blood vessels in your body. This leads to a loss of feeling in your hands and feet, as well as decreased blood flow to these areas. As a result, people with uncontrolled diabetes might not be able to feel an injury on their foot, and the injury can become infected quickly. Infection. Diabetes patients often get infections in their gums and teeth, as well as other places in the body. The eyes. Patients with diabetes may also experience eye problems. The glucose can travel to the eyes and accumulate there, causing blurred vision, or in severe cases, cataract, glaucoma, or even blindness.
Well, Cici, now you know everything there is to know about living with diabetes. Stay healthy and stay happy.